Governor Larry Hogan giving us the update from Annapolis on our COVID-19 situation and coronavirus. Let's listen to what he has to say.
Their teams have been working around the clock to marshal an unprecedented public health response and to get shots into the arms of every single Marylander who wants one. This effort grew from about 4 people to more than 11,400 people all across the state who are working around the clock to vaccinate millions of Marylanders. Today, Maryland has surpassed the incredible milestone of 4 million vaccines administered. It took 94 days to reach the first 2 million doses. And the second 2 million vaccinations have been accomplished in just 35 days. Maryland is vaccinating at a faster rate than the nation and than most other states. As of today, we have vaccinated more than 82% of all Marylanders over the age of 65 and more than 55% of all Marylanders 18 years and older. The Biden administration, as I've said, has recognized the state of Maryland for having one of the nation's first and most advanced equity plans, and Bloomberg ranks Maryland as a national leader for vaccinating minority populations. As of today, our more than 3,000 points of distribution have expanded to include 509 pharmacies and 104 doctor's offices. And our equity task force is adding dozens of new clinics each week. Tomorrow we launch the state's newest mass vaccination site at Ripken Stadium in Harford County, and we will open the 13th mass vac site at the mall in Columbia in Howard County the next week. That's next week. We have also expanded the no appointment necessary option. Tomorrow we will add no appointment walk-up lines at Navy Marine Corps Memorial Stadium here in Annapolis, the Baltimore Convention Center Field Hospital, and at the FEMA site in Greenbelt. We've also expanded our no appointment walk-up lines at M&T Bank Stadium, at Western Maryland and Eastern Shore mass vac sites, and we will continue to increase more of these opportunities in the coming weeks. We're hitting some milestones at the mass vaccination sites. Six Flags is just about ready to hit 250,000 vaccinations. The Southern Maryland site reached 100,000 vaccinations as of today. And yesterday, M&T Bank Stadium reached a new high for them of 1,000 vaccinations in just 1 hour. The best way to be guaranteed a vaccine and to get through these sites quicker and easier is still to pre-register and secure an appointment at covidvax.maryland.gov or to call the state's COVID-19 Vaccination Support Center at 1-855-MD-GO-VAX. While 4 million vaccinations is a remarkable achievement, we still have a ways to go before we can declare mission accomplished. Our goal throughout this massive effort has remained the same, and that is to provide a vaccine to every single Marylander who wants one. To further that goal, today we are launching a series of new No Arm Left Behind initiatives, which will involve every state agency, private industries, and in every demographic in an all-hands-on-deck effort to make sure that every Marylander who wants a vaccine can get access to one as quickly as possible. This will include redoubling our efforts to reach that remaining 18% of Maryland seniors by going county by county and zip code by zip code in an effort to get every senior vaccinated. In addition to conducting vaccinations at every nursing home, every assisted living and long-term care facility, we have also completed or scheduled clinics at 98% of all the other senior housing facilities in the state. We're also proactively reaching out to and directly contacting more than 70,000 of the state's Medicaid recipients age 50 and older who have not yet received a vaccine, and we're booking appointments for more of them every single day. We're also conducting clinics at senior centers across the state through partnerships with Rite Aid, Safeway, and Giant pharmacies. And today I signed an executive order to authorize the reopening of senior centers across the state for safe in-person activities. Everyone who studies at any Maryland higher education institution is strongly encouraged to get vaccinated. State health officials are partnering with the Maryland Higher Education Commission to conduct direct outreach to all campuses in the state. And we're blocking off and reserving appointments at mass vaccination sites, specifically for college and university students, including reserving slots at the Greenbelt FEMA site, specifically for students at College Park. And we will be partnering with 42 public and private universities, colleges, and community colleges on a public information, social media, and ad campaign to ensure that we get our students vaccinated. Another critical component of this No Arm Left Behind initiative will be partnering with some of the largest employers in the state of Maryland, including Southwest Airlines, Exelon, Comcast, Amazon, and many others, to help ensure that their workforces are being vaccinated as expeditiously as possible. And I want to thank the President for announcing a new tax credit, encouraging employers to provide paid time off for employees to get vaccinated. We're also continuing to conduct vaccine clinics for essential workers at manufacturing facilities across the state, including the clinic at Seacare in Linthicum Heights, which I visited earlier today. And we're conducting outreach programs to Maryland's agricultural workers as well. The Vaccine Equity Task Force is expanding the use of mobile clinics to vaccinate people in hard-to-reach areas. They have now conducted more than 50 different clinics for targeted populations, including this week when they held the first no appointment necessary walk-up mobile clinic in Cumberland. Maryland was one of the first states in the nation to stand up a multilingual vaccine support call center, which has now taken more than 1.5 million calls to answer questions and book appointments at mass vaccination sites. Our No Arm Left Behind initiative will enhance the capabilities of our state call center to include providing direct assistance to Marylanders who need assistance in getting a vaccine. If you're homebound, you need transportation or technological assistance, we will put you in touch with all of the resources that you need in order to get vaccinated. The call center is available 7 days a week from 7 a.m. to 10 p.m. by dialing 1-855-MD-GO-VAX. And support providers are now available in over 200 languages. As part of the next phase of our statewide vaccine confidence campaign, we're launching a new public service announcement featuring physicians from across the state talking about the safety of the vaccines and encouraging people to get vaccinated. And this campaign will be expanding further in the coming weeks. Next to getting vaccinated, the most important thing you can do is to encourage all of your neighbors, coworkers, friends, and family to get vaccinated as well. Research shows that people feel more comfortable getting a vaccine when they hear about the experience directly from someone they know and trust. We truly are close to that light at the end of the tunnel. But those of you who have not yet been vaccinated, please go get a vaccine as quickly as you can. Do it for yourself, do it for your family, do it for your friends, and do it so that all of us can finally put this global pandemic behind us. Now I'm going to turn it over to Brigadier General Burkhead to provide an update on the efforts of our Vaccine Equity Task Force to expand the use of mobile clinics. General?
Thank you, Governor. Good afternoon. Thank you, Dr. Chan, for all your hard work and partnership. Since Governor Hogan's appointed the Vaccine Equity Task Force, we had worked very hard, nonstop, with local departments, community stakeholders, to serve the underserved and to bridge the health outcome gaps that exist, ultimately increasing Marylanders' access to the vaccine. With many years of professional experience and interagency cooperation and efforts toward equity and equality, our Maryland team, combined with the state, local influencers, and organizations, are working to ensure no arm is left behind. Our hard work is starting to pay off. As of April 17th, Marylanders' state-to-state ranking designates the state as 5th in the nation for vaccinating Black Americans, 8th among states for vaccinating the state's percentage of Asian population, and 13th amongst states for vaccinating the state's share of the Hispanic population. As Maryland's Governor Hogan said, equally as important as getting a vaccine yourself is helping someone you know to get the vaccine. This is precisely why it's crucial for the Vaccine Equity Task Force to exist. Our data-driven approach leads the task force to engage those communities who may otherwise be left behind. Each of Maryland's 24 counties provided an equity plan, and we thank them for their hard work. Realizing that they cannot do it alone, the Vaccine Equity Task Force has performed and or assisted in vaccine distribution in all 24 jurisdictions. To date, we have helped with more than 42,000 vaccines. Recently at M&T Stadium, currently a state max vaccination site, we hosted the first Faith Leaders United event where a diverse group of faith leaders came together with their families to receive vaccine and to get information. The faith community has been and continues to be an integral part of this partnership. Trusted voices are so important in this endeavor and adding to the diverse collection of this effort every day. In Waldorf, Maryland, I spoke with a leader in the Piscataway Conoy tribe after a recent vaccine clinic, which was co-located and co-hosted with Prince George's County and Charles County Health Departments. This is a meeting where we're meeting people where they are, near their cultural center in their neighborhood. In Baltimore, Lieutenant Governor Rutherford toured the vaccine site at the Bilingual Christian Church. They host clinics with after-hours appointments to schedule people after work and to meet people where they are. On the Eastern Shore, we are partnering with faith-based institutions and community activists who are mobilizing their local community to get their family and friends and those in need that extra nudge out the door to get their vaccine. In Cumberland, the Wellmobile set up a pop-up shop at the local Boys and Girls Club to bring vaccine that last mile. Today, we projected delivering over 2,000 doses to various sites to include our Wellmobile clinics. Our Wellmobile Vax will traverse 11 counties over the next month to deliver the vaccine to hard-to-reach areas. While we feel hopeful, it is not time to celebrate just yet. That's why the task force will continue to partner with a variety of organizations, such as the Boys and Girls Club in various counties, the Preakness Latino community, the Pan-Atlantic Council, the Archdiocese of Baltimore, and many others to defeat this virus through equity. I am pleased to announce some exciting news in conjunction with the academic community. Historically Black colleges and universities are more than just hallowed ground for learning. They are also part of the community. So I am pleased to announce our partnerships with two of Maryland's HBCUs. Morgan State University, the largest HBCU in Maryland, will host 3-day walk-up clinics starting on April 30th, delivering about 390 doses of the Pfizer vaccine. This is open to all tiers and will allow not just students and faculty, but also the broader community to get the vaccine. And yesterday, we completed a site assessment at Bowie State University, the oldest historically Black university in Maryland. And on April 26th, the Vaccine Equity Task Force, in conjunction with the university and the county, will hold a town hall to educate and provide vaccine on that same day. We will move forward with mobile vax on that campus as well. Thank you to our partners and thousands of Maryland National Guard members who have paused their lives to be here conducting COVID-19 operations over these past year. The continued contribution in defeating this virus contributes to this success. The Vaccine Equity Task Force will continue to work hard to get to community immunity. Please visit our website And if you need additional assistance, please go to 1-855-MD-GO-VAX. Thank you so much.
Thank you. With that, we'd be happy to take a couple of questions.
With the about college students, you said encouragement. I just want to make sure, is it going to be mandated? Or if not, why not ask them to just get it mandated?
Yeah, I know that the Board of Regents and the Chancellor are considering that decision right now. They're the ones that would make that decision for the university system. The other colleges, it would really be up to them. I know a number of colleges across the country are mandating it. And, we would encourage them to do so, but that's not an action that requires any executive order or any health department order from us. That would be a decision by the university system or the individual universities. But we want to make sure everybody that is returning to the campuses is safe and that they all get their vaccines.
Governor, there's a lot of debate about what exactly herd immunity looks like, whether that's 60, 70, 80% vaccinated. Are you concerned based on the fact that you now seem to be pushing to get more people to come and get vaccinated, that Maryland might have difficulty reaching something that looks like an acceptable herd immunity number?
Actually, I'm really encouraged because there were a number of national studies and that came out and said they did national polling and they didn't think more than 62 or 63% of the people would get vaccinated, and we've already done 82% of our most vulnerable population. It's over 65, and we're well on our way to getting the rest. So we're actually ahead of where we thought the maxed capacity was, but we're going to keep going. I'd love to see 100% of the people, but I don't think anybody ever anticipated getting to that level. Dr. Fauci at one point was saying 60 or 70% would reach herd immunities. Others think it's 80 or 90. We're at the very high end of that scale, and I want to keep pushing until we get there. Every person that wants one is going to get one. But no, we're not concerned at this point. We're pretty pleased with the progress.
The ability to give walk-ups at more and more places, and yesterday you pointed out that you had open slots at Six Flags. I know there's about 780,000 or so pre-registered, but are you starting to see the demand fall off? I might have asked this before, but how are you able to do these walk-ups? Are appointments opening up now?
So it's always been kind of the plan to keep expanding with more opportunities, but we also I've said for months, at some point, it's going to start to slack off. We want to keep them filled and keep moving at the same pace. Right now, we're continuing to move at the same pace, but we're having to do lots of creative things to get the same number of vaccines done every day. Because we've opened up so many new opportunities, because now you can go, instead of was 34 pharmacies, now you can go to 509 pharmacies, almost every pharmacy in the state. Because now you can go to your doctor's office, because we now have 13 mass vax sites, because we've done all these clinics everywhere, Equity Task Force, what's happening is, people are getting vaccinated. So we've got 4 million vaccines done. The other people are scheduled. And what's happening is, I think in some cases, we have up to maybe 20% drop-off on when people schedule an appointment. That wasn't happening before. People were showing up for their appointments. Now they're like, I just got it at the CVS, so I don't need to show up for my appointment. Or, I got it down the street at Giant or Safeway. So that drop-off, if we're doing 3,000 or 5,000 people a day at that mass vax site, and 20% of the people don't show up, then we have 600 or 1,000 extra shots. We want to use every single one of them. So this is with the walk-ups. It's let's use every one we have. You can't plan for how many people are going to show up. You can't know exactly who's not going to make it to their appointment. But so far, we haven't dropped off at all. We keep using the same number or more, and we're still making progress. And that's why we're doing all these things, to keep the demand. But at some point soon, I said we're going to be shutting down mass vax sites, and we're going to be out. Everything's going to be, finding those last few people, knocking on doors, calling them on the phone. We need you to get a vaccine. It's, we're at that point now where we're getting up to the hump, and we're going to start coming down the other side.
Governor, I have a question in relation to the Biden tax credit announcement. Do you know, or do you have an estimate of the percentage of working adults in Maryland who have been vaccinated or gotten at least one shot?
Percentage of working adults.
Okay.
I'm sorry, I don't know that one, and I actually didn't. They didn't talk about this announcement today at our call in the White House yesterday. So I haven't actually seen the announcement. I think it sounds like a good idea, but. When we were out today, I think you joined us at the last stop where we're at a manufacturing facility. We're actually doing the vaccines right in their facility, so nobody had to take off work, and they're working and they're just taking a break to go get the vaccine, which we're trying to do also in all of our large employers. But certainly it's a good idea for those people like I just called you a doctor. You're a Dr. General Burkhead. We'll call you General too. She was talking about this, about going out to reach those folks in some of the pop-up clinics where they're doing at churches where they're doing it after hours because people that can't get off work. So we want to do everything we can to make it easy for somebody. And we understand it's hard for people when they're working, they have to go home, take care of a family, that they don't have time to go.
And also in terms of the White House, is there any news from your latest call with the White House in terms of, did they inform you about the emergent report ahead of time? Or is there any
No, it's funny. We had a call. Is today Wednesday? Yeah, Tuesday, yesterday. Seems like a long time ago, but it was yesterday. We had a call with the White House. They were very hopeful on emergent and J&J, and their story to us was that they hoped by Friday that this decision would be made, that there were millions of doses, ready to be shipped, if and when that the FDA makes their decision. So the report today they said nothing about, but it's hopefully they'll get it resolved. This is something I guess we haven't had all the information. They're not that forthcoming with all the information, or maybe the FDA doesn't talk to the White House, or the White House doesn't talk to us. I'm not sure, but sounds like they inspect these facilities every 2 years. The feds paid for the facility and built the facility. FDA had done their last review in 2019. I'm not sure. They're telling us that they expect J&J may be back available as early as Friday, but I don't know if that's actually going to be true or not.
Governor, I'll be looking at the numbers of the cases across the state, and maybe Dr. Penn can chime in on this as well, but Baltimore City, Baltimore County continue to have some issues. Are you worried about some of the surges in some of these areas right now, or what do you recommend?
We are. We're very pleased with the state numbers because again today they're all down, we've kind of been on a plateau for a couple of weeks now, but the past couple of days almost all of our numbers are down. Today our daily positivity rate is down substantially. Our 7-day positivity rate is down. Our case rate is down to the lowest point it's been in a long time. Hospitalizations are down. ICU down. So every metric that we look at, the state is in better shape than we were last week and the week before, and we're hoping that that's a pattern that will continue. But we remain very concerned about the fact that every state to our north is in the red zone and we're not, and that includes Pennsylvania and Delaware. And we're seeing some of that creep. A lot of people commute across the state line. They live in Pennsylvania and work in Baltimore County or in the city. People from Delaware are coming into Cecil County, and so we're seeing Baltimore County, Baltimore City, and Cecil are the only ones where we seem to have the opposite going on than the rest of the state, and we are concerned, which is why the real key is getting everybody vaccinated. If everyone's vaccinated, we won't have anybody positive, or very few. We'll have 4% maybe, out of the 96% efficacy. I think I skipped you. Yeah. Brad can't get a second question until you.
Are there particular parts of the state or groups, demographically, age-wise, that you're seeing these vaccination rates at a lower level that you think you're supposed to be struggling with right now, or that are particularly concerning?
There's nothing that's dramatically concerning, or there's definitely different rates in different areas for different reasons. But overall, we're pretty pleased with where we are, and wherever we can, we're trying to boost those numbers where they're down. Yeah. Go ahead, Brad. I'm coming right back to you. I don't want to put him on hold twice in a row. You might. There. I got you, man. You're next.
Look, on a completely different subject. Yesterday we had a burden in Minneapolis. Police reform ended up moving on through the veto overrides. Crime is up in Georgia County. Murders are 100% up. There's a whole different bunch of things there. But do you have a vision for moving forward, how to address these issues? What should, where we can go? What do you have in mind?
Well, it's no question we've still got a lot of work to do. And, yesterday I think, I was pleased that the decision came down, I've said from the beginning this was a brutal murder of George Floyd, and the fact that they came down with that quick decision, guilty on all 4 counts, I think was the right one. I think hopefully that's going to be a part of healing, both for his family and for all, communities all across the country. But we've got work to do. We've still got to address the violent crime situation in addition to police reform. And defunding police or getting rid of police forces is not going to help us with our violent crime problem. And that's so this past year I was pleased that the state Senate nearly unanimously passed our tough crime bills. And they died again in the House for the second time. We have 350 murders a year in Baltimore City, and murders are up in Prince George's County, and I'm not sure how getting rid of police or defunding them is going to help that situation. So we've got to work on both, figuring out a better way to do our policing, to do more community policing. I think, I've said before, we have to address some of the systemic problems. We have to do police reform, but we also, people say, well, let's not put more money into the police. Let's not hire more police. And I think that's a mistake. It's like saying we want to improve education, but we're going to cut funding for education and we're going to get rid of teachers. We've got to improve the training, de-escalation techniques, and body cams, and more community outreach, and get our police forces as strong as they can be, and working with the communities better. And we got to root out bad cops, and we've got to heal the rifts in the communities.
Last one. Vaccine passports, Governor, where do you stand on it? There's some for it and some against it because of privacy concerns. What do you think about vaccine passports?
I'm sorry, with the mask, I'm in the back of the room. I hear.
Vaccine passports.
Yeah.
Some are for it, some against it because of privacy concerns. What do you think about it?
Yeah, it hasn't really been an issue that has come before us. I know the debate on both sides of the issue. I'm not sure that it's going to happen. I think certain people have been talking about it, like Major League sports, for example, have talked about we can fill stadiums again if we make sure everybody has a vaccine. There are a lot of different ways to look at this situation, but it's not something we're focused on at the state level. I think it's something they're going to be trying to address at the federal level. But thank you.
All right, Governor Hogan wrapping up an update as far as the COVID-19 here is in our state. 41 million vaccines provided so far in Maryland, and 12th in the nation right now for vaccine distribution. The governor says that 82% of people 65 and older in our state have been vaccinated, as well as 55% of people 18 and older. Ripken Stadium mass vac site will open tomorrow. And he also talked about the walk-up sites. We're going to see more of that at Baltimore Convention Center, as well as the Navy Marine Corps Memorial Stadium. You'll be able to walk up without an appointment to get a vaccination. Big emphasis now on the No Arm Left Behind campaign, where they're trying to spread the word to get people vaccinated. Senior centers are going to be opening up, direct outreach to seniors. And also they talked about the success of the Maryland Vaccine Equity Task Force. Brigadier General Janine Burkhead says that they've been able to get out 42,000 vaccines, reaching out to the underserved community. We're going to be all over this. We'll have the details coming up for you on the news at 5 o'clock right here on ABC2 WMUR.